Fox 12 Investigates has been reporting on ambulance response times in Multnomah County for the last year and a half. We found that an increase in 911 calls and questions over the county's ambulance staffing model was causing higher wait times for those needing an ambulance.
A new plan started back in July of 2024 aimed to fix that. Fox 12 investigative reporter Adrian Thomas is in studio with more now on how that new plan is working.
So we've talked to real Portlanders who called for help while in excruciating pain for an ambulance, but due to a shortage in paramedics, ambulance staffing, and a new triaging system for calls, they were left to wait. But some of the changes made are showing promising signs. In August of 2024, the Multnomah County Board of Commissioners approved an agreement between the county and AMR to address long ambulance response times. A key part of the agreement was a more flexible staffing model for the ambulances to free up resources. Now, at a briefing to Multnomah County Commissioners today, county health officials say there are noticeable improvements in response times, but there still is work to be done.
We're encouraged by the upward trend here from AMR. However, AMR hasn't quite yet reached contract response time compliance. So while this is a bridge to meet those response times, it's also a bridge time for AMR to grow their workforce.
AMR is the American Medical Response Ambulance Company that contracts with Multnomah County and other counties in Oregon. The settlement agreement now allows certain ambulances to be staffed by 2 EMTs, others with 2 paramedics, and others with a hybrid pairing depending on the type of ambulance. After months of this new staffing model, the data is in and it's encouraging. AMR response times have shortened incrementally in every category, including in urban areas and rural areas, and for both life-threatening and non-life-threatening calls. For example, urban life-threatening responses need to make 90% of their calls on time, which is within 8 minutes or less to meet their contracted agreement. In February, the most recent data on the county's dashboard, AMR was at 87%, though that marks a 24% increase in just 6 months. Life-threatening and non-life-threatening calls in rural areas were also below 90% in February, though both metrics are on a positive trajectory. AMR has also reported unprecedented levels of hiring in Multnomah County over the last 7 months, including over 36 new paramedics and 75 EMT and paramedic students set to graduate from programs this year and next. And they're all committed to work in Multnomah County for a minimum of 2 years. In studio, Adrian Thomas, Fox 12 Oregon.